Hi guys, I'm Kaylee.
And I'm Kayla.
And we're here today. We created a program for our client, Maya Kneehurts. She has a medial collateral sprain to her right knee, so that's her MCL. So in our first video, Michaela will describe what she's going to be doing.
So we're going to start off with the Inhibit and Lengthen phase. So we determined that her overactive muscles are going to be the lateral gastrocnemius, the bicep femoris, the short head, the adductor complex, and the TFL. And so with this, we are going to start off with some self-myofascial release, and from there we'll go on to some static stretching.
And then in the second video, I'm going to be the trainer, and we're going to be talking about the underactive muscles, which are the medial hamstring complex, the anterior and posterior tibialis, the medial gastroc, and the glute med and maximus. So in this video, we're going to talk about activating and integrating those muscles.
Okay, so we are moving into the Inhibit and Lengthen phase with Kaylee as a client. So we are going to be doing some SMR, self-myofascial release, on the lateral gastric. So I'll get you just to sit down on the mat. Good, and so you're gonna pick the right leg because she did sprain her right MCL, so good. And so we're going to turn the foot outwards because it is the lateral gastric. And so you're gonna hold this for roughly 30 to 90 seconds and just roll around until you feel a tense in the spot. Good? Yeah. And so we're going to do one set of this as well. And so as she's doing, you can put your foot on the other side just to add more tension to the muscle. And how does that feel?
Sore but good.
Good. Good. Just a couple more seconds. Good. You can release. Good. And so now we are going to move into our lengthening phase for the gastrocnemius. So I'm going to get Kaylee just to go against the wall. She is going to just put her foot against and just lean it just like this position. Good. We're going to hold this for 30 seconds as well. Awesome. How does that feel? Good. Good. That's good. So we are going to now be doing some more SMR on the bicep femoris short head. So I'm just going to show our client Kaylee how to do this. So we're going to move the foam roller onto the bicep femoris and just roll until you feel a tender spot. And once you do, you'll hold that for roughly 30 to 90 seconds as well. Okay. So I'll get you to try that. It's more or less on my right side. Yeah, on the right side. Again, because of that's where the MCL sprain is we're on the right leg. Okay. And just roll around. You found a spot? Yeah. Okay. Let's hold that for about 30, 90 seconds again. Okay, good. And so now that we have just done the SMR, we are going to move on to the lengthen phase with the bicep femoris short head. So I'm going to demonstrate how to do this. We are going to lay on our back. And so with the right leg, you are going to bring it up in full extension. You're going to bring your opposite arm and reach across just to give your leg more support. And just extend and hold that for, again, 30 seconds. So I'll get you to try it. And with the opposite arm. Good. Good. And how does that feel? Good. So again, it'll be 30 seconds. Okay, so we are here again with our client, Kaylee. So now we are going to do some more SMR with the adductor complex. So I'm just going to demonstrate how to do that. So we're going to lay is prone on the ground. We're going to do the right leg in this case, but we would do, in most situations, we are also going to do the left leg as well. So with the right leg, you're going to bring the femoral and the adductor complex, and then just roll around until you feel any tense muscles, and then do that for 30 to 90 seconds. Once you feel a good tender spot, you want to hold it there. So you do that. So side prone on the ground, and go around until you feel a tense spot. Hold that for 30 to 90 seconds. And how does that feel?
Good. Tight.
Again, you would do that for both sides as well.
Because I made money last year.
So now that we just did some fascial release on the adductor complex, we are going to move into the lengthen part of the continuum. So now we are just going to, I'll demonstrate you how to do the stretch. So we're going to come into a side lunge, making sure that both feet are pointed forward, and just with this hand, just drive